So here we have today, we have Mr. Chin. Mr. Chin had a heart problem. I'll let him explain what his heart problem was. Pretty specific, it was pretty intense. And he wanted to come on tape and tell you about his story because it's kind of cool. And we're gonna have his testimonial. I'm gonna put it up on the web, and I'll see if I can put it on YouTube, so we can all read his testimonial. But let's let Mr. Chin talk. Mr. Chin, just tell us anything you want to tell us from the beginning to the end.
Okay, about 1.5 months ago, okay, I have a mild heart attack. Okay, my chest I have a very severe pain on the chest. I can't breathe, and so immediately I went to see a doctor.
All right, so we were interrupted, so I'm going to go back to Mr. Chin, and I'm going to try and get him to... Sorry, Mr. Chin, we got rudely interrupted. Go ahead, please.
Okay, about 1.5 months ago, I have a mild heart attack. My chest was very painful, and I can't breathe. So immediately I went to see a doctor, okay, and the doctor told me that he cannot treat me. He need to send me to the hospital. So then, since I can walk, I decided to go to the hospital the next day. So the next day, same thing happened, and this time the pain is so painful that I really cannot stand. So my wife sent me to see a cardiologist. So the cardiologist did the ESG on me, did the echo on me, and also finally do the cardiac stress test. And the result is, he told me my problem is due to the narrowing of the heart arteries. So did he say what the narrowing of the arteries was? No, he didn't explain. He told me the narrowing is caused by the deposit of the plaque, and also the high cholesterol, and also the high blood pressure. So he then advised me I should go for an angiogram, which must as well insert the stent.
Yeah.
Okay.
Yeah, we all know about those. Yeah.
That will prevent. That will stop my symptom. But then immediately after I left the cardiologist, I visited another doctor to seek another. Did the first? Sorry, Mr. Chen, I got to interrupt you. Did the first doctor tell you what the treatment was going to be like, or what? Okay. What he said is they are going to insert wire.
Yeah, the angiogram. After that, though, did he tell you what's going to happen after that? Did you need open heart surgery, or did you need a stent or something?
No, he told me you have to insert the stent.
Oh, okay, insert stents, right.
You see, but after I left the cardiologist, I visited another doctor to seek another advice.
Right, second opinion, very good.
Second opinion, right. The doctor also insists that I should go to insert the stent.
Wow. So none of them had any other ideas?
What they plan is they need to speed up the operation.
Right.
Okay? So they want me to do it as soon as possible. Then I was given 2 days rest, and during these 2 days I started to get worried.
Yeah, must have been scary. I
do a lot of research on the internet, and the more I read, the more I worry, because what I also understand is when you insert the stent, there is a possibility that you will get a heart attack.
Yes.
So that worries me. So I couldn't sleep until the night before I supposed to go to the hospital. Then I sent an SMS to Peter.
To me. I remember that.
Founder of this Ozone Hospital, Malaysia.
Right.
His reply gave me a light. Okay, on another alternative. Okay. So the next day I visited their clinic, and that's where I met Dr. Alias.
Let me stop short because we don't want to keep this too long. Let me just ask you a couple of questions and you answer them for me. how did you find Dr. Ali as a doctor? How is he?
Okay, Dr. Aria's treatment is quite different from all the doctors which I visited before. What he actually do is he patiently explained to me, okay, the process of the EBO, okay.
That's RHP for us folks.
Yes,
go ahead.
Yes, and he also listened to me on my problem, and then he did a blood test on me before carry out the EBO process. And after going through the blood test, he will find out that there are certain things that I'm not doing well. So he will then rectify it and educate me, and also find out what are the things that I eat regarding my diet and also my supplements. Then he will tell me that there are certain supplements which I miss, which I have to take. Then following his advice, I carry on taking those supplements. And then after subsequent EBO treatment and the microbubble treatment, he then do additional blood tests, and from the additional blood test, then he will find out that what's wrong with me and what improvement that I get during the treatment.
So what you're saying, Mr. Chin, is that all along the way, and every time we did something at the hospital, every time we did something at the clinic, hospital, whichever way you want to call it, we would take tests just to figure out what we were doing, whether it was this way, that way. So there was numerous tests that you went under. There was numerous therapies that you did, and the therapies will be listed in your testimony. So that's okay. We don't have to go through that. They're explained rather well. Mr. Chin did a really good testimony on paper, so I'm going to put it up. What we want to know is, after how long you've been with us now, Mr. Chin? I can't remember. About.
I think it's about 1.5 months.
Okay, so 1.5 months. So tell us, how do you feel? What's the difference? We know that you felt right away, you felt a difference after the first treatment. We know you felt differences continuing. You had microbubble, you had stem cell therapy, you had all kinds of therapies done. And I know that Dr. Ali also gave you traditional Chinese medicine. He gave you some of his own traditional Malaysian stuff. So, well balanced all around treatment. But how do you feel now after all that? This is after a month and a half, folks.
Okay, what I want to mention is when I have the heart attack, okay, I couldn't even walk one single step, and I was wheelchair to the hospital. But after 1.5 months treatment, today I managed to walk and run continuously, non-stop, for 4 kilometers, once in the morning and once in the evening.
Wow. So, so Mr. Chin, that you couldn't even walk a step. That was how long ago? That would be 90. No, it would be
1.5 months.
1.5 months. So 45 days ago, you couldn't even walk one step. Now you can run 4 kilometers in the evening and 4 kilometers in the morning. And there is no pain, no stress, no nothing. Are you out of breath? Are you short? Do you have shortness of breath or anything?
No, nothing.
Amazing, man. That's pretty good, folks. I think that's the best testimonial that I could ever give you. Anything else you want to say, Mr. Chin?
Okay. What I wanted to say is I would like to thank Ozone Hospital Malaysia for giving me another chance to live for a longer life.
It's our pleasure, Mr. Chin, and thank you very much for doing the interview. Thank you so much, sir.